So we're going to do just a quick high-level overview of some of the responsibilities for ORI, if we can go to the next slide. So our primary responsibilities are to support the IRB, IACUC, and IBC functions, which all function as independent committees, so independent of each other and independent of the institution. The IRB is primarily focused on protection of human subjects, where IACUC deals with humane care and use of animals in research, and then the IBC is specific to research with recombinant DNA, biologics, and human gene therapy or gene transfer protocols, right? So the review by these committees is required either by policy or regulation in all cases, right? And in many cases, both, right? Depending on your funding source, where you're conducting the research, and those kinds of things. MHRI serves as the executive agent for research for all of MedStar Health. And so our institutional officials for both human and animal research sit within MHRI. And the jurisdiction of the Human Research Protection Program actually extends to all research conducted either at a MedStar facility or conducted by MedStar associates. So even if you're going out into the community and working with a local youth sports team, or going into the school system or somewhere else outside of MedStar, if you're conducting that research activity on behalf of MedStar Health, that activity is covered by our Human Research Protection Program. Next slide. Couple of things to get you started. For human research, you want to make sure all of your team members have completed the required city training. We currently are running animal training for animal research through ALAS, so that has to be completed. If you have questions about that, you can always contact the ORI staff, either through the help desk or directly through their personal emails. A couple of other things to consider are management or review of outside interest, right? For consideration of whether or not there is a conflict of interest and management plan is needed. Anybody who's going to be involved in the research, either human or animal research, is also going to have access to or accounts in our electronic submission systems, either Huron for human research or Streamline for animal research. Next slide. For the IRB, so any information related to human subjects research, there are a couple of ways you can get information. Obviously, you can always contact the ORI staff and ask questions directly, and we encourage that. We're trying to make this as user-friendly as we possibly can, keeping in mind we are dealing with policy and regulation. So, we understand that it can be confusing and challenging at times, so we welcome questions. But we're also trying to improve our content on our website. So if you do a Google search for MHRI IRB, one of the first links you'll come to will bring you to this web page, which includes a lot of information about basic information and guidance of who you can contact, how different things work. And again, we're working on improving this content. Some of this is also available through Starport. Next slide. For the IACUC, the information we put on the public-facing website is more limited and more kind of general information about animal research. More specific information will be coming on the Starport page. So if you're involved in animal research, you want to look at both of those for information at different levels. Next slide. IBC, for IBC, we currently don't have an internal committee. So all of these, any of the research that requires IBC review, we outsource to other sources. So you'll actually find pretty much the exact same information on the public-facing website as you do on the Starport page. If you have questions about this, again, reach out to ORI staff. We can kind of help guide you through the process of submitting a project that requires IBC review. Next slide. There we go. And again, just definitely we encourage people to reach out to the ORI staff. This contact information is on the public-facing IRB website, and it includes some information. If you go to the actual live website, you can expand this to see what different areas different IRB staff are covering in terms of clinical areas or IACUC versus IBC and things like that. But if you have questions, I would say you can reach out to any or all of us. If we're not necessarily covering the area you have questions about, we can help direct you to the person. And even if that the answer requires going to someone outside of ORI, we're not going to just kind of say that's not our job, right? We'll do whatever we can to help you find the person who can help you get the information you need.